Pranay, we're live now, so you can start.
Perfect. Right. All right. A very good evening to everyone who's attending this session. This session is called Conversations on Male Sexual Health by Prati Sandhi, which was basically done to discuss experiences and challenges relating to male sexual health and the practices that we should undertake to ensure like a good male sexual health, right? And this is in because of the Men's Sexual Health Month that we're organizing, right? So, very quickly, I'll begin with our panelists. We have four very esteemed members here today. The first being Dr. Sudhir Bhola, who is an award-winning Ayurvedic sexologist in Delhi. He's the founder of Curewell Therapies, a chain of clinics which claims to offer treatments for sexual disorders, obesity, skin and hair problems. He's been honored with the International Excellence Award for his work in the field of sexual medicine and the Rashtriya Swasthya Rashtra Gaurav Samman in the year of 2014 for his contribution towards serving society by giving free treatments, and also the Best Sexologist of India Award by Dr. Yoganath Shastri, amongst the many others in Ayurvedic medicine, in his career which spans over 3 decades. Thank you, Dr. Bhola, for being with us today.
Thank you.
Our second panelist is Dr. Vijay Ramanathan, who is a triple postgraduate in sexual health from the University of Sydney, Australia. He's a very well-experienced clinical researcher and educator and supervisor in sexual health. He has done the first of its kind doctoral research on sexuality of Indian migrant men in Australia, and he teaches a variety. He teaches variations in sexual function and is a consultant in sexual medicine as well. Thank you, Dr. Ramanathan, for being here.
Thank you.
Our third panelist is Dr. Martha Lee. She was surrounded by friends who were always sexually inhibited and struck by dire lack of positive conversation. She set out to make a positive difference, embarking on a doctorate in human sexuality before launching EROS Coaching in 2009. Today, she remains dedicated to working with individuals and couples who wish to live a self-actualized and pleasure-filled life. She also holds certificates in counseling, coaching, and sex therapy, and her fourth degree, a master's in counseling in May 2018. In practice for more than 10 years, she's the only certified sexuality educator and certified sexuality educator supervisor by the American Association of Sexuality Educators, Counselors, and Therapists in Singapore. Our fourth panelist is Aman Singh. Aman is actually a student at the University of Illinois. Who has a knack for public speaking. He's extremely passionate about sexual health awareness as well, and he took sex ed classes as well when he had gone to Yale University. Thank you, Aman, for being here today. Right? So before we begin with the panel, I would just like to inform everyone who's attending that if you have any questions, if you want to say anything, we have a chat option. Please mention them in the chat option and they'll be addressed at the end. So we'll be following a round-robin fashion where a question will be addressed to a certain panelist, and anyone else who wants to also add on something absolutely can. And at the end, we'll keep a couple of minutes for questions and answers for the participants. So without wasting any more time, we'll just begin with the first question, which is for Dr. Martha Lee, which is the fact that, ma'am, you have done extensive research on sexual inhibitions, right, and sexual desire discrepancies as well. Can you please tell us what are the most common inhibitions that you find in your field with the men that you have worked with?
Yes, thank you for having me, and thank you for this question. So I haven't done a lot of research. I don't really do research. However, I have done a lot of studies, and I have worked with a lot of clients around the world, and a lot of my clients are Asians, and of course, I also work with clients who are Indians from India and also Indians from all around the world. And the most common inhibition when it comes to male sexuality, I would say, besides all the common sexual issues that men would present, premature ejaculation, erectile difficulties, and delayed ejaculation, I think the most common inhibition they have is with communication. I think society or culture has brought us up in such a way that the man is supposed to take the lead. And when it comes to sharing their emotional vulnerability, they have a lot of challenges with communicating and speaking their truth. So if they don't have good news, they don't want to say it. And this causes a lot of misunderstanding with their partner, and it can lead to feeling separated and isolated from each other emotionally. It could lead to a breakdown in communication. It could lead to separation or even divorce. So this whole idea of the male bravado, having to have all the answers and keeping it to themselves, is causing a lot of difficulties when it comes to relationships.
Absolutely. Thank you so much. So men out there, talk more, you'll be fine. Right. Panelists, if you have anything to add on, I won't ask you. Please just jump in whenever you feel like. Right? Right. So the second question, so now the question I have next is for Dr. Vijay. Dr. Vijay, growing up, especially with people who are young adults or adolescents, right? They often face a very high level of sexual drive due to, the change in hormones and the high levels of testosterone that they have, right? This can often lead to sexual frustration among young boys who don't have a method to vent this out, right? So how can we tackle such sexual frustration, especially in a scenario where sexual activity or intercourse is not really an option?
All right. Look, I would like to thank Pritishanti Foundation for having me and actually organizing this wonderful session during a very difficult time. So kudos to your effort. I really like the question because you did mention sexual activity or intercourse. And this is something I own a lot and I talk a lot about, that sex is not about intercourse, okay? But that's something a lot of men and women understand. Sex is equal to intercourse. Intercourse is only a part of a whole suite of activity, okay? So I would like to acknowledge that you have actually differentiated sexual activity or intercourse. So that's a good start. Now, going deeper into the question, Pranay, I think let's not just focus on testosterone, okay?
Right.
That energy, the urge, okay, to have sex, okay, around that young age, there are a lot of factors, and testosterone is one of it, and a lot of unopposed action of testosterone. So if you look into more of the neurological models, the one model that I often use in my clinical work and I teach students is called the dual control model.
Right.
So it's like driving a car and having one leg on your accelerator and the other leg on the brake. Okay, so in the young age, it's more like putting a full throttle on your accelerator and there is a very gentle pressure on brake. But as we grow, there could be a possibility that we'll be start looking into more of the brake. Mainly the incubation comes from the consequences of having sex or the anxiety and performance about functioning. So those are the two elements of the brake. So what do we do when sexual activity, which includes or doesn't include intercourse, what are my options? Well, sexercise. I'm bold to throw this word at the very beginning, okay? I'm not trying to, masturbation, okay? But sometimes the word masturbation is the trouble, okay? Because that's my whole PhD was on masturbation, okay? But I use the word sexercise with boys and young men because it sends a very positive message, okay?
Right.
Because like every other part of the body we exercise, the end organ in a male, one of the end organs is the penis, and that needs exercise. And at the age you ejaculate, okay?
Right.
So yes, so when sexual activity or intercourse is not an option, masturbation or sexercise is also a sexual activity, but what we would encourage is more of a mindfulness-based practice, not just looking at some raw porn and just doing it for quickly, rather taking time and doing it in a structured way so that you actually enjoy. Okay, so I will leave it there, but we can come back to it later.
Right.
So the message is masturbation is a positive thing. There are some health concerns and there are some moral concerns. So moral concerns is very hard to win over, but from a health point of view, World Health Organization, the WAS, and there are a lot of benefits of masturbation.
Right. Dr. Bhola, would you like to contribute to what Dr. Ramanathan has said?
This was excellent narration by Dr. Vijay. I really appreciate. Actually, he's well said. Masturbation or sex exercise is a very much important thing in one's life. And especially when a person comes into his adolescence, at that time the urge is too much. Because one thing I would add here, because at that time he's not having any kind of stresses or any kind of responsibilities on his shoulders. He's just enjoying his life. He's just enjoying his adolescence. So at that time, the testosterone levels plus no stress at all, nothing of the other jobs to be done, no responsibilities at all. So they are more at peak at that time for doing that.
Right.
Here I would like to tell something. What the world needs right now is the techniques of the masturbation. Well, here I would like to add one thing. If there are a number of patients who visit me, they have been a victim of a wrong way of masturbation. Like one is the rubbing the penis, just lying on the bed upside down. That damages, gives some damage to the cavernosa. It's not in a proper position that he's masturbating, and that leads to ED at his advanced age. So if we just make it something public, and we should give some techniques and tips for the masturbation. Now one thing, there is one item called male training kit, men's
Right.
training cup,
Right.
or male this masturbator. So if a person gets that because intercourse is no way comparable with masturbation.
Absolutely.
We know it all. Because the rejuvenation of the cavernosa, or penile erection tissue, what rejuvenation it gets while intercourse or doing sex exercise through that men's training cup, what that gets during that, it cannot be done just by rubbing it against the bed, against the wall, or just by twisting your penis. Because I get a lot of patients. I've seen thousands and thousands of patients who come to me. They just contradict their, they are into they are having so much myths about masturbation is wrong.
Right.
Masturbation is not wrong, but the ways they do the masturbation, that could be wrong.
Right.
Number one thing, the way of masturbation. The second thing is in normal case, in 70 to 80% cases, the boy is when he is into his family, when he goes to the washroom, he just shakes his hand very fast just to get the ejaculation, so that nobody is going to question him why you took so much time in the washroom.
Right.
Now, just in the fear of that, he should not be caught masturbating or like that. What he does is he shakes his hand very fast. Now that keeps on, building up over the years. And when it comes to having intercourse with his partner, at that time he realizes he's ejaculating very fast.
Right.
Because he's been trained himself ejaculating very fast, because at that time the only motive was to get the ejaculation, which is the ultimate pleasure.
Right.
So these things, even in the family, like father and mother should be educated. They should give a space to their younger male child,
Right.
so that he should not have any kind of fear. And rather, I would say that father himself should explain to his son that masturbation is nothing bad, because a few small time quacks and neem hakims, what they picturize this masturbation as, you are just ruining your health by masturbating. You are ruining your you are wasting your semen. This is 100 drops make 1 drop of cement, this and that, and blah and blah. This is what that has cluttered and polluted the mind of younger generation.
Right.
Pranay, I just want to.
They just come with the fear, doctor, I have ruined my life. I had been doing so much mistakes, this, that. So first of all, I try to make them relax. It is nothing that if you don't masturbate, you will be getting night falls. That will be more disturbing for you. So that's it.
Right.
So Pranay, I
Yes, Dr.
just want to
Ramanathan.
add a few things. Yeah, just few things to add. So thanks, Dr. Bola, for the beautiful
Absolutely.
explanation. See, the type of masturbation that Dr. Bola says is called idiosyncratic type. Okay, so a number of men do that because they think touching the penis with their hand is a mistake. So if I rub it against a surface, that is somehow okay. Okay, so that's something I want to add. I'm not sure whether that actually destroys the cavernosal muscle, but what it can happen is when they rub it, they're actually triggering a particular point, the bottom side of the penis. But when they're trying to have intercourse, they're not going to get the same level of pressure and rubbing. So that causes a problem when they're trying to have intercourse. Okay, so that's something, it's purely mechanical. Okay, because the thing is, when you masturbate holding the hand or rubbing it against a dry surface, you cannot simulate that when you're having intercourse with a partner. Okay, whether it is a male or female. So that's where the problem starts. And the neuroplasticity, if you practice something over 1,000 times, you're forming a particular pathway in your brain. And that's when you start masturbating quickly, if you're programmed to do that, then that becomes a problem at a later stage. Now, so in my PhD, I looked at this. A lot of men, up until they masturbate and ejaculate, they find it very pleasurable. They do it. But the moment they ejaculate, they feel very bad about it.
Absolutely.
But that feeling bad won't stop them doing next time. They'll still do it.
Right.
So what's happening here is, as a vicious cycle, the thoughts, the feelings, and the actual act of masturbation is not aligned. If somebody thinks everything, they have the right knowledge about masturbation, if they feel good about masturbating, and if they continue to masturbate, no problem. But if they continue to masturbate, but having misinformed knowledge about masturbation and they're feeling terrible after ejaculation, that can cause problem.
Absolutely. Right. So that makes sense.
In sex therapy, what we try to do is we try to align the thoughts, feelings, and behavior in one line. Yeah?
Right.
Yeah, I'll stop there. Okay?
Absolutely. Absolutely. Thank you. All right. So moving on, my next question is for Aman. Aman, so you basically live a student's life which is supposed to be which is considered to be extremely social, and I'm sure that every student lives that life, right? So does the exhaustion of college and leading the life of a college student actually impact your sexual health or a person's or a student's sexual health?
Right. So just the way Dr. Vijay and Dr. Sudhi were talking right now, that like we have the organs in our body and we tend to have physical exercise to keep them in order and maintained. And in today's world, we're also raising a lot of awareness about mental health, of how we should have mindfulness and make sure that our mental health is not being impacted by the number of things that we get involved in. So the exhaustion of a college life or a student's life in general, because just like a point was raised up, that young adolescents have a lot of sexual urges and desires because they tend to be stress-free at that age group. And this time where a student kind of enters high school or tends to get into universities and colleges, that's kind of where all of this pressure starts to pile up, that they have a curriculum that they need to take care of, internship, part-time jobs. So that is where this stress kind of piles up on. And something that we often forget is that this stress does eventually impact one's sexual health. And because of the disregard around sexual health, we tend to not have, as Dr. Sudhir put it very aptly, sexticize. So because of the amount of taboo that there is around masturbation and in general sexual health, we never talk about it. We never realize that it does get impacted by our heavy and rigorous schedules. So a student should keep that in mind, that just the way that we often try to exercise throughout our day, we try to start our day with some meditation to make sure that there is mindfulness and we are taking care of our mental health. Our sexual health is equally important, and we need to take care of that as well. So that's definitely a very big part of something that gets impacted by a hectic lifestyle.
Right. Absolutely. Right. I would like to. Any other panelist who wants to add something to what Aman said, or I think he covers it pretty well.
Pranay, if you don't mind, I just want to add something.
Absolutely. Absolutely.
See, one of the problem is masturbation is seen as a pleasurable activity. That's fine. But the question arises is whether it's going to be a rewarding pleasure or a routine pleasure.
Right.
Okay. A number of times what happens, the first thing they come back from school and nobody's going to look at the sky and masturbate, right? They're going to watch something stimulating. Right. So they spend about an hour or hour and a half, they masturbate. And once they masturbate, they feel sort of dosed. Okay. That's a natural phenomenon of ejaculation and orgasm, right? Which are two separate things. So what happens after that, they may not be able to finish their homework or project work.
Absolutely.
So that piles up and that can create problem for the next day. So the issue here is not masturbation, it's about the timing of it. So rather what I would encourage is, okay, you have a task for the day, you finish it off, and then you spend an hour masturbating and reward yourself. That way you're not piling up or getting lagged in your work. At the same time, you're getting the pleasure that you want. And when you do the last thing, then you can go have a nice sleep.
Right.
Not an issue. But when it happens at a time, it's going to take up the time for their homework or project, especially in the student life, it creates a problem.
Right. Absolutely. Thank you, sir. So coming back to Dr. Bhola, sir, you spoke about erectile dysfunction, right? When you were adding to what Dr. Ramanathan said. So erectile dysfunction is one of the leading problems that men face, right? So does erectile dysfunction necessarily make you impotent, or is there a difference, or is there a scenario where ED might not cause you to become impotent, cause impotency?
You see, erectile dysfunction is a broad term.
Right.
It can be because of psychological factors. It can be because of the arterial insufficiency. It can be because of so many factors. So it cannot be said definitely that if a person is suffering from erectile dysfunction, that person is impotent. So it is absolutely wrong to say that.
Absolutely.
So now one thing I would like to add here, why so many younger generation, especially in their 30s, they are coming to my clinic for erectile dysfunction and premature ejaculation. Why? Here I would like to clear to everybody, Pranay,
right,
that why this happens is because there was only and only masturbation.
All right.
Up to the age of 30, 35, 32, there was only masturbation. They were very much comfortable doing masturbation.
Right.
That too, watching porn, as Dr. Vijay said.
Right.
So, there are a number of cases where it is porn-induced erectile dysfunction. You see, when a person sees something into the porn, that is all exaggerated, so much with the drugs, injection shots, the performance is enhanced like anything.
Right.
When a person himself gets into the activity, he doesn't get that erection also. Because what he has seen in the porn, he's not actually seeing in his either in his partner or himself.
Right.
So the best part of doing masturbation is just visualizing, fantasizing, doing it with your own mind.
Right.
Your mind won't create those fantasies whosoever you are thinking about. So don't get dependent upon the porn, number one. Number two, you do masturbate, but it should not be you are doing it the whole day 5 times. I do come across patients like that. They just keep on masturbating.
Right.
Like Dr. Vijay said, They just even sacrifice their tasks of homework and all that.
Right.
So let it be not more than, here I'm telling from my own experience, it should not be more than once every alternate day at the most.
Right.
At the same time, if you cross your 20s, try to hook up with someone to have natural intercourse also.
Right.
Because number of patients they are coming these days, they are just busy in building up their career. And they have got no time to just get into any kind of relationship. They are just busy doing that, and simply they are masturbating whenever they are feeling any kind of stress
Right.
to use it as a stress buster.
Right. Right. Right.
Now, if they keep on, if they've got the experience of intercourse as well, in
Right.
that is when they get married, at even at the later stage of say 30 or more than 30 years, they will be able to penetrate their partner.
Absolutely. Right. Thank you, sir. Yes, Dr. Martha, coming back to you.
Yes.
Before that, I would just like to clear something out to the attendees. Just if you have a question on something that any of the panelists has spoken, you can put it in the chat. They'll read it and answer it on the spot, right? Please leave the actual Q&A session for when we are at the end and we just take questions and answers from the crowd, right? Right. No, Dr. Martha, not an issue. Right. Right. Now coming to Dr. Lee. So my question being that in our organization, right, we very often get questions which say that, how do you make your penis size bigger, or what is the length of an average penis? So how do we begin tackling these insecurities? And does penis size actually have a connection to good sex?
I was asked this today actually. Actually, a sexologist in India messaged me today from LinkedIn. He asked me what is the size of penis that most women like, and I think it's very very subjective. And there's also this saying: it's not what you have, it's also what you do with it. So there are many things that one can do if they think that they have a small penis, or their partner complains that they have a small penis. I
Right.
wish, okay, this is what I wish. I wish that I could be so open with my partner that I could talk about penis extenders, because there are sex toys that you can use to lengthen the girth and even the length of a penis. So it can be great fun if you can customize the size of the penis, isn't it? So
Right.
I think it's all about variety. But a penis is not just about penis. Sex is not just about physical. It's also about emotional intimacy. It's also the sense of feeling loved. It's also the feeling of oneness. So if I work with so many people who have difficulties with their erection and their ejaculation. So
Right.
what if one is actually more comfortable with their hands? Because there's so
Right.
many things we can do with our hands, with our fingers, with our tongue, with sex toys, with enhancers. There's so many things, and yet we keep getting caught up with penis size, penis size. So in reality, the urologist would actually recommend going for surgery. But I think a lot of Asians are very, very adverse to surgery because there are always the fear of things not working. There's always the fear of scarring and the fear of um, accidents happening, no matter how good the surgeon is. And not to
Right.
mention, it's of course very expensive. So
Absolutely.
there are people who still keep asking me and keep insisting on asking me whether there is a way that can make the penis bigger without involving surgery. And my answer is no. My answer is no. I do not know of any way. And maybe there are other ways, but I refuse to keep having the dialogue around penis size only.
Right.
It's so much more than the penis.
Absolutely.
Anyway, I just stop there because I can go on and on.
Right, absolutely. You can go on and on if you want, but that is right. Aman, do you agree that there is no actual connection between penis size and good sex?
I would definitely agree with Dr. Martha, and this is something that's a big insecurity within young adolescents. And I believe it was one of the most Googled questions in a certain few Southeast Asian countries a few years back as well. and it's a big insecurity amongst young men. And I believe it's also because of the fact that there is no open communication within their partners and within their friends, that they're able to talk about it. That does it really matter for the other person? Because it tends to become a myth that revolves in circles, that it is something that matters. And just like Dr. Martha said, that it's a very subjective part as to what
Absolutely.
another person likes. So I think communication is a big part between the people involved
Right.
in the situation. And yeah, the communication is a big part of how to resolve this insecurity.
Right. Absolutely. That makes a lot of sense, actually.
Right. I
Yes.
just want to chip in few things.
Absolutely.
So it's interesting about penis size because we did a study here looking at women's perception of penis size. And so we are looking at length versus thickness. So there are two different elements.
Right.
Now, there are a couple of things. One is a lot of this stems from the misunderstanding that vagina is the most pleasurable sex organ. Okay, so the penis has to be long so that it can go somewhere deep inside and trigger a point somewhere inside the vagina, when in fact clitoral hood and clitoris is the most erotic
Right.
zone.
Absolutely.
Okay? So from a fertility point of view, we need a certain size, but from a pleasure point of view, it's not a particular size. Okay.
Right.
But also we have to remember from a social side, women are now becoming a lot more literate and aware. So
Yes.
that awareness creates an expectation, and expectation creates anxiety.
Right.
Okay? So say, for example, a generation before, probably they didn't have anyone to compare. So they accepted whatever they saw. But now, I'm not saying it as a mistake or wrong. That's the way it is. And that's something they have the right to demand, they right to expect. But once again, they're also watching pornographic movies. So once again, that norm is taken from there. Okay.
Right.
And a lot of perception of how men feel about and look at their penis. Even, for example, asking men to measure their penis size is not easy.
Absolutely.
Okay, from where to start? And if they have a big tummy, then the penis appears to be sucked inside their own tummy. So
Right.
there's a lot of issues we need to take into consideration.
Right.
And just a point I want to go back to Dr. Bola's question that you had about erectile dysfunction in younger men.
Right.
Because June is the month of men's health, I want to throw this once again. A young man presenting with ED, yes, psychological, the behavioral thing is a major issue, as Dr. Bola rightly said, but also bear in mind, ED can be the first sign of having a cardiovascular events, high cholesterol and bad health. Okay. Now you can think, oh, why 30 years is too young? But the data clearly shows in the Indian population, especially in foreign countries, the risk of cardiovascular disease starts at the age of 30.
Right.
Okay, so if a person, once again, all psychological, everything is ruled out, we need to be mindful whether it's a first sign of something related with their heart and overall health being manifested as erectile dysfunction.
Absolutely right. So,
and probably I would say let's not use the word impotent, because that's sort of, that term has been made redundant a few years back.
So what should we use? What's the alternative?
That term is, just call it erectile dysfunction as
call it
erectile
ED,
dysfunction,
right?
premature ejaculation as premature ejaculation.
Right. Absolutely. That makes sense. Right. So 2 takeaways from those answers. 1, men, please do not be afraid of the fact that your penis might be smaller on an average. And something, if I'm allowed to contribute, even I feel that the exposure to pornography that people have from a very young age actually kind of makes their mind think that, okay, that is a certain length I'm supposed to achieve to get some sort of pleasure for the woman. But like both the doctors have cleared, that is not the case. Absolutely. Right. So
one moment.
Absolutely.
I would like to add one thing.
Hanji.
The younger generation is not very much concerned about their erect penis,
right,
when it is used, but they are most concerned in a flaccid state.
Right.
Because if the flaccid state, the penis is very small, they are very much conscious about it. They don't want to urinate in public and all that. So that is also one of the criteria where it is not at all concerned. But young generation is very much concerned. And as rightly Dr. Vijay said, when your tummy is big, it is just hidden in the your fat portion. And same way, if a person just looks at his penis in a proper full view mirror, he will astonish himself that I am having a better size.
Right.
So that is
absolutely right. All right. Right. So moving on to the next couple of questions I had. My next question actually being for Dr. Ramanathan. That being that, so you have worked, very extensively in the field of psychosexual therapy. Right. So what is actually the scope behind psychosexual therapy, and how can it actually help enhance a person's sexuality?
Okay, good question, Pranoy. I think the psychosexual therapy is the stream that I teach and I work, and education forms a big part of therapy. Okay, I'm sure any sex therapist anywhere in the world, a lot of their work starts with educating. Okay, say for example, if a client comes and sits with me and I ask him, okay, after going through the introduction, so how can I help you? If he says to me, oh, I have erectile dysfunction, and this is not uncommon. They say, I have erectile dysfunction. I have to challenge them by saying, okay, let me say that at the end of the consultation. Okay, so let's start, because what's happening is men are going out to anyone and everyone. Okay, there are some well-qualified, well-affiliated experts in the field, but there are also a lot of self-claimed, not well-qualified doctors. Okay. And when they go in, when they don't take a proper history, and if they're in a couple relationship, you need to take history from the partner. When they're not following through a proper procedure and gets a consultation in 10 minutes and being written 5 different prescriptions in the next 5 minutes,
right?
Somehow it stays in their mind that, and if the medication doesn't work, okay, because they haven't taken a proper history. For an average layperson, in their mind, okay, I had a problem, I went to somebody for help, they gave me medication, even that is not working for me. Therefore, my problem is much bigger. Okay? So what happens is, it's then written on their head that they have a bigger problem.
Absolutely.
So, for example, if a client comes to me and if he or she doesn't know anything about sexual function or sex for that matter, that is a blessing for me, because it's a plain white paper. We can write a script together. But that's not what I'm getting. I'm getting people with a lot of scribblings, and a lot of information is wrong, misinformed, like Dr. Bola said, Dr. Lee said. So the first task is to go through with them and erase a lot of the scribblings. So what happens? The paper doesn't look clean.
Right.
But as part of therapy, we start from there. And therapy plays a very important role. Okay, I just published an article for GPs in Australia that sex therapy is about, you don't have to be an expert in that if they're practicing doctors. Okay, not everybody can be a sexologist. Okay,
absolutely,
and that is not possible. But if they're a gynecologist, if they're a men's health physician, or if they're a general physician, even giving them permission to talk about it, and not frowning at when a client says they have a problem with sex, or rather waiting for them to open up, the doctors can open up, okay? And giving some information and making them, and make them feel their concerns are listened to, I think it's a big win, okay? So this is all part of sex therapy, but when they come to us, a trained sex therapist, we will take through a complete history taking and education, and then we will look into from a psychological interventions, okay, behavioral interventions. So that's what sex therapy does. And just for your information, one of the common myths is sex therapists, like massage therapists, they're going to do hands-on work with clients. They're going to make them strip naked. That is not true. Okay, the code of practice is very clear that we don't do any hands-on therapy. Okay.
Oh, all right. All right.
So sex therapy is not like massage therapy. I just want to make that statement very boldly and very clearly. We a lot of societies, I'm the president for the local branch here, it has
Right.
come up so many times, sex therapists do not touch the client. Okay?
Right.
And there is one section that's sexological body work. That's a different story. Let's not confuse here. But sex
All right.
therapists, it's more like a cognitive behavior therapy and so many other therapy modalities, but no hands-on.
Right. Dr. Bhola, you specialize in Ayurvedic sex therapy as well, right? So while you therapize someone and help their sexuality, is this the methodology you follow as well?
Yeah,
Right?
definitely, definitely. We have to go to the history of the patient, how he got into this kind of disorder.
Right. All right.
So after assessing and examining, then we take the diagnosis.
Right.
According to number of cases, because of no exercise and no healthy lifestyle, a lot of patients present with low testosterone levels.
Right.
So that is also one of the reasons. So if it's because of low testosterone,
Right.
in that case, we supplement them with some very good herbs.
Right.
Yeah.
Brilliant. Right. Coming back to Aman. Aman, you living the life of a university student, and as another university student, I can vouch for the fact that one of the major parts of a lot of students' lives are alcohol, drugs, and other substances, right? Something that they might be voluntarily doing, some might be under peer pressure, X, Y, Z reasons, right? So how do you think that alcohol and drugs and any other substance for that matter actually affects the sexual life of a person or a man?
Right. So, apart from the direct biological consequences that these substances will have on someone's body, I think something that I personally noticed in my friends and people around me who've been involved with drugs and alcohol is that they tend to turn towards these substances as a coping mechanism. That, again, as I raised a point in the previous question as well, that stress is something that catches up to students during their college years, and the plethora of stress that they have, they don't find a way to communicate it or just vent it somewhere.
Right.
So they tend to turn to these substances as a way to cope with it, a coping mechanism, and a rather unhealthy coping mechanism. Because at the end of the day, it can't help you deal with this. It can't help you deal with such complex emotions that you might be facing. It can only ever temporarily subside it and put it at the back of your mind. And eventually, what I have noticed within my friend circle itself is that because this stress is never dealt with properly and it just is compartmentalized and it is put at the back of someone's head, they tend to walk around with this stress and it affects other spheres of their life. So, just the same way that it will affect someone's mental health, and the time that they're sitting alone, they might break down about all of the stress that they'll be facing throughout these days. It similarly impacts someone's sexual health as well. They might not be having the same levels of libido that they might normally have, or they might not be interested in sexual activity because that stress is always at the back of their head. It's never been properly dealt with. And an unhealthy coping mechanism being narcotics, drugs, and alcoholic substances, they always tend to turn towards those instead of communicating this. And that lack of communication as well. For a lot of people, sexual activity is kind of formed on an emotional intimacy basis. Like, it's not about all about physical intimacy, it also involves an emotional connection. So if that communication is not there within people, that sexual drive also goes down. So yeah, that is definitely there. It does definitely impact a person's sexual health, and
Right.
that unhealthy coping mechanism exists in many
Right.
university students.
Right. Dr. Lee, do you believe that how in what other ways does drugs and alcohol, if you could provide a more biological perspective to it, how drugs and alcohol actually affects someone's sexual life or sexual performance?
Yeah, drugs and alcohol can help someone to be more relaxed. However, it can also inhibit. So depending on the person, they may feel that it enhances their sexual performance, but then for other people, it may inhibit their sexual performance. And what happens that I hear from some of my clients is that the results vary. So it's not that, oh, sometimes it helps and sometimes it doesn't help. Actually leaves the person very, very confused. So I think
Right.
this is a matter of learning what works for your body. And another thing about drugs and alcohol is it can cause a numbing effect. So just because somebody can
Right.
last longer, as in the erection can last longer, it doesn't mean that they may be able to ejaculate. So because of this numbing sensation, what can happen also is you might be more rough with your partner, you might cause pain to yourself, and you don't realize it until after the effects of the drug and alcohol has worn off. So this can actually cause some
Right.
damage actually to the body. So when you're young
Right.
and the sky is the limit, like everything is okay. However, there are people who develop a dependency on it. Like, okay, I feel like this is the solution, this helps. So then you always keep doing it, and
Right.
you're not actually necessarily learning any skills to support you to be more in touch and more connected with your body. So this is where psychosocial skills and psychosexual skills can support you, because when you have the skills, this is something
Right.
that you have for yourself. And when you have the skills, then you have the confidence. And when you have the confidence, you can be relaxed during sex and you can be more
Right.
playful and creative. So I feel with a lot of my clients, they do want to be better lovers. And it's very easy for me to say, don't just think of your penis. Don't just think about lasting longer. If you don't give them information on what actually addresses their question, they are just going to keep having the same question. But once I've
Right.
taught my clients how to last longer or how to overcome their erection challenges, then they are finally ready to hear what the women have been harping about, which is it's not about the sex, it's about the communication.
Right.
It's not about the sex, it's about whether you're even looking into my eyes. It's not about the sex, it's about whether you're thinking of someone while you're having sex with me. So a lot of this they're not ready to hear,
Right.
they just want to know how they can last longer. That's it.
Mm,
Right.
So,
Absolutely.
so just want to
Right.
add from that, a few things.
Right,
Okay, so
sir.
it's a very important question. Okay, drug and alcohol. So let me start deconstructing the question one more time. So when we say drug, we are talking about recreational drugs. Okay, so all the
Right.
references. But let's not forget some of the medications that we use for other health conditions, and that impact on sex life. Okay. For example, drugs used for depression, antidepressants or antipsychotics, those sort of regular medications does have impact on sex life as well. Okay. Now, as Dr. Lee very well said, there's a waving effect. It might have an excitation effect early days, but over a period of time, it becomes inhibitory. All right. So it's a very important question, and there are so many drugs coming out, and some of them we really don't know what's in the drug
Right.
combination, right? And chemsex has become a major issue, I'm sure, even around Singapore, in that belt. Am I right, Martha? The chemsex has now becoming a big issue because, see, for example, when you have a problem, you take a medication, that's a different story. But when you want to enhance, when you don't have a problem, the drug is not going to work the same way. And that is not uncommon, especially in the younger generation. They don't have any issues with the erection, but still they want to enhance it. So they start taking medication for it. And then they start somehow believing that they cannot perform without that medication.
Right.
Okay, so it becomes a vicious cycle there.
Absolutely right.
Yeah,
Right. All right.
I add here something.
Hanji. Yes, Dr. Bola.
Version, the same thing. Even leave aside drugs and alcohol and everything. A number of cases when a person is going on a first date or like that, just out of curiosity or just fear of performing well, they just keep a pill in their pocket, just go and take this Viagra or Megalis or anything, Cialis, whatever they want to take, just to prove themselves out of anxiety of whether he's going to perform well or not. And without any need or any requirement for that kind of drug or any substance, they start using, and then they get into the trap of it. They cannot perform without that. So,
Right.
like you said, Dr. DK.
Pranav, I just want to add one more thing. Sorry to take up the time, but I think it's quite
absolutely
important. Testosterone is now creating a big hoo-ha around it. Okay, people think, I want to be macho man. I want to be, I want to be aggressive and all of that.
Right.
So they start taking testosterone, and one of the problem is when your testosterone level is normal, if you take more than what is normal, then it's going to have a negative effect on your body. Okay,
Right.
so that's quite important. And also, I have come across test reports that were taken, the blood sample were taken around 3 o'clock in the afternoon, when naturally the body will have less testosterone in a man. Okay, because the patient have seen the doctor around that time, so they've given a sample while they are there in the clinic, and that is around 3 o'clock, for example. The sample will show low levels, and if the person is going to be treated based on that report, then that's going to have a negative effect as well. So it's usually testosterone have to be tested in the morning between 8 and 10.
Right.
Okay? But please, one key thing I want to get out of this is please do not self-medicate, whatever the medication is, whether it's testosterone supplements or whether it is sexual performance enhancing drugs.
Absolutely. Absolutely, right. So always visit a sexologist or a doctor before you
please, and also not buy online drugs. If you look into the black market, there are so many online products now. Okay, you can just get anything and everything under the sun.
Absolutely.
And so many counterfeit products out there.
Right. Dr. Bhola, coming back to you, right? So so one of the main questions that we faced is that what actually causes this loss of sex drive in men? So if you could just, tell our audience, why is there this, either a systematic loss in sex drive, or is there like a timely loss? So if you could just help us with that.
You see, like I earlier said, sex it starts in between the two eyes and not between the two legs. If your mind is free, if you are relaxed, definitely you will be in a much better position to think about sex.
Right.
If you are overstressed, it can be a stress of your job, it can be stress of your family, it can be any kind of stress. It can be stress of your study as well. The student preparing for any special services or say IAS or any kind of study he's into, and if not able to cope up with that, he gets into that kind of stress. So even then, he may suffer from a loss of libido or the loss of desire to have sex. So has to for a healthy lifestyle, the best thing is if a person meditates, even if 15 minutes a day, or do some breathing exercises.
Right.
Apart from that, just abstaining from junk food and alcohol, whatsoever it is, and just maintaining a healthy lifestyle would make a person to be stress-free and a better immunity, leading to a better libido and desire to have sex.
Absolutely. So do you get this problem very often, men coming to you and telling you that they don't wish to engage in sexual activity anymore?
Very common. Very common. Because, as I told you earlier also, these days, the generation, they are more concerned not about just feeding their family, but the maintaining their status of the family. For that, they are just going for, better and better careers. So for that, they sacrifice each and everything. They sacrifice their health. They sacrifice their pleasure. They sacrifice their each and everything. So just for the sake of getting a good social status. So this is very much common. Yeah.
All right. Thank you, Dr. Bhola.
Can
right.
I
Absolutely, sir.
expand on that?
So you don't need to ask. You
So
can just go on.
uh, that's due process to ask the
Right.
facilitator. See, on
Right.
the poster that you have put, I'm just looking at closely. Next year, we should put a small picture of brain somewhere, okay? Because it's all
Right.
penis and mustache and sperm, okay? So
Right.
that's just the jokes are jovial side. But coming to the serious note, let's also acknowledge asexuality. Okay, I don't know whether you heard of this
Absolutely.
term. Okay? So
Absolutely.
it's asexuality is a very complex topic. The celibacy and asexuality is worshipped in some cultures, including
Right.
ours. But asexuality is also seen as a problem. Okay,
Right.
because somehow we see everybody has to be sexually motivated, have a certain level of desire. Okay,
Right.
and then we start examining and questioning what's wrong. Okay, rather accepting it's a way of living. Okay, but
Right.
now there is more and more recognition for asexuality. Okay, so
Right.
that one side. So coming back to the issue of libido, which is sort of, we need to remember the drive, the biological, the hormonal stuff, and then we have the motivation. Okay, motivation plays a big role, and third
Right.
thing is the socio-cultural values. Okay, so libido on itself is not a big problem, but the
Right.
desired discrepancy is the real challenge. Okay, if a person is alone and he or she has lesser sexual interest or drive or desire, that in itself is not a bigger issue. But when they form a relationship and when there is a discrepancy, usually the person with
Right.
lower desire is seen as problematic. Okay,
Right.
so that becomes even more challenging to deal with desired discrepancy.
Absolutely. Absolutely right. Right. Aman, my next question was actually for you. So growing up, especially in the society that we grew up and like we've grown up in, we know that there is this huge thing, like there is a huge gender stereotype, right, which actually plays a giant role in actually a person's behavior and their actions, right? So do you actually believe that there is a narrative of quote being a man that is being followed or that has been or is being followed? If you could shed some light on it, if you have a couple of examples from yours or any other person's life, if you could just help us, like if you could just help tackle that.
Right. So I think that's a very great question because it's an issue that I believe in not just our culture, it's being faced by men everywhere. And it's
Right.
being faced by men of all age groups, not just young adolescents and young men, but men of all age groups. Because, and there are a number of facets to this. The
Right.
one that I've most commonly seen in myself and my friends during a very early age is because we're exposed to a lot of pop culture, movies, TV shows, and we see that the optimal body image for men is that muscular gym image. A lot of people face insecurities with their body image, and they tend to not engage in sexual activity even though they want to, or even though they feel that they want that sort of physical intimacy with someone else, because they feel that they might not be in the best of their body image. They want a more muscular body, and that's the optimal body that a man should have. So that's a very, very common one that I've seen in a lot of people. Another one that I've seen is that just like Dr. Ramanathan just raised an issue of how complex asexuality is, we tend to forget that people might not be interested in sex 24/7, because there is a big narrative that men are interested in sex 24/7, and that you can go up to a man and he will be always interested in sex. So any time that a man seems
Right.
stressed, or even if he doesn't seem interested in any sort of sexual activity, it is seen as unnatural, and it is seen that something that is out of character for a boy, a young or adolescent, or any man. So that's a another
Right.
thing. And something that kind of promotes this is another vicious cycle that kind of people get into, and that's that men are the one that need to take initiative with sexual activities. They are the one that need to start things. So
Right.
there might be a person who might not be comfortable entirely, who might have a number of insecurities, but it is always assumed that a man will take up initiative. They will always be interested in these things. So there are a plethora of things like these that exist in various cultures today that prevent men from even talking about these things. They develop more and more insecurities, and because of that communication gap, they're never talked about with their partners, with their friends, and it eventually leads to a huge gap, and
Mm.
that definitely plays. And I guess it's a very, very big issue. It's a very big
Mm.
issue when it comes down to it, that men need to fit a certain stigma or an image, and they need to
Absolutely.
check off certain boxes. So yeah.
Mm.
Right.
And
Absolutely.
sexual
Um,
spontaneity is another big narrative, And see, I really admire the way Aman Singh you put things together. So happy to see that the young generation sort of so thoughtful in the way you articulate the responses. And just adding on to that narrative is the sexual spontaneity. Okay,
right.
if I can't perform sex in the so-called natural, spontaneous way, then that's not good enough. Okay, and that plays
Right.
a role when you're taking medication or you're involving any sex toy or anything into that sex play. Somehow it's not spontaneous. Okay, and that creates problem in both men and in couple.
Right. Absolutely.
Mm.
I believe that there is a question on the chat box which I want addressed, and I believe a lot of people want to address the fact that this. I'll just address it to Dr. Martha. That does smoking cigarettes cause erectile dysfunction or any sexual problems, right? Because like a lot of people smoke, right? And I have also read cases where people actually experience sexual issues after like 20-30 years of continuous smoking. So is there an actual um, you know connection between smoking and sexual health? Putting it
Yeah,
that way.
because what happens with the smoke is that there's the tartar that actually builds up the plug around the blood vessels. So obviously, if the blood vessels is constricted, there is less blood flow to the whole body, including the penis. It is
Right.
not beneficial to smoke. That's all. And I'm sure that
Absolutely.
there have been many research of how the effects of smoking can start to diminish after one stops smoking. But really, I feel that it's like playing roulette. If you know that there's no benefit to doing something, why do you keep doing it? I think a lot of
Absolutely.
people smoke because they think it's cool. They have come to associate smoking with relaxation. But in reality, smoking is actually causing, through the repetitive behavior, through the conditioning, the belief that you are relaxed, when in essence you are actually introducing poison into your body. So I strongly encourage all people, because I don't smoke, but I strongly encourage all people who are smokers to kick the habit, because you're wasting time, you're wasting money, and you're risking your health. And
Absolutely.
if more men knew that smoking causes problems with their penis, why would they do it? Don't do it. Just don't start. If you are doing
Absolutely.
it, please stop.
Absolutely.
I second it, Pranay. I second
Yeah.
Dr. Mata's
Right.
call for it. In a very simple way, I'll put it this way: anything that causes damage to your health is going to cause damage to sexual health. That's it.
Absolutely.
Okay.
Right. Very well put. Right. I think, yeah. I don't think anyone on this panel would disagree with the fact that smoking actually, harms your physical health and your sexual health. Right.
That's right.
Right.
Or
Dr.
otherwise, if we say
Right.
smoking is definitely affecting you, it is leading to cardiovascular diseases.
Correct.
Absolutely.
It is directly leading to cardiovascular diseases.
Right.
So it is definitely affecting the performance in sexual activity.
Absolutely. Right.
And Pranay, I just want to add on to that. Now
Absolutely.
that in 2020, the trend is a lot of people know that smoking is dangerous and causes health, but still they want to do something. Okay, so they're switching on to vaping and
Vaping.
e-cigarettes.
Right.
Okay, and that
Right.
is also going to cause problem. Okay, it's still there. Data is still coming out.
Right.
But once again, vaping does have nicotine. Some of the oils do have. So just don't look for a other option thinking that's better than the traditional cigarettes.
Right, because there is
And
no
after we said, please reconsider what are we doing?
right, because there is no healthier alternative to smoking. There is actually no healthy option rather than quitting it, right?
There is nothing one good thing about smoking, to be very honest.
Absolutely. Right, absolutely, I agree.
Yep.
Right. My next question is for Dr. Bhola. Sir, that do you feel that there is this, a barrier or a stigma that, men face when they're, because you get clients, do you think there's a barrier or stigma for men when they actually approach you for sexual therapy, for sex therapy? And what are these very usual questions or myths that you have to, kind of bust when you're giving sexual therapy or someone participates in sex therapy?
Yes, I do come across a number of patients who are very much hesitant to even see a sexologist or a sex therapist. So we're just feeling the social stigma that now when they just approach me, or even when they are just hesitant to just approach me to my clinic in person, when they take an audio call, I just tell them, you can suffer from any kind of disease. This is also part of your system. If you can have
Absolutely.
headache, if you can have any blood pressure problem, you can have thyroid problem, you can have metabolic disorders, you can have obesity. The same way you've got some problem with your sexual system. So there is
Absolutely.
harm into that, and that is not because of your doing. It is because, Pranay, they think that is self-inflicted on them.
Right.
They have got the guilt of that, thinking that they have done this thing, something wrong to them by just over masturbating over the years, and that's why they don't want to just show to the sex therapist or
Right.
doctor.
Right. So,
In
sir, do
fact,
you? Huh.
like that. In fact, they should be educated that it is not that the problem they have started suffering is because of their any kind of whatever they did. As Dr. Vijay also said, there is so much social stigma about masturbation. It's
Right.
absolutely not because of that.
Absolutely.
So they have to only educate it properly. And I think if people like you and me, we start just educating the way you are doing this thing,
Right.
we can overcome this kind of problem in the future generations.
Absolutely, sir. So, do people often come up to you and assume that they have erectile dysfunction, or they go through premature ejaculation, or delayed ejaculation, or anything of the sort? Like,
It
do
is,
they come with a diagnosis in hand?
yeah, it is very much strange that nowadays, because of this internet and Google Baba and all that, whenever patients come to me, as Dr. Vijay said, they come and tell, I've got erectile dysfunction, I've got premature ejaculation.
Right.
Everything that they know. Here I would add one thing.
Right.
Phimosis, nobody knows about it.
Right.
It is not very much popular these days. And that is why even if they are suffering from acute phimosis, there is a pinhole in their foreskin to pass the urine. Still, they
Right.
don't know about it. Even their parents don't know about it.
Right.
So it is rightly said that you should seek a help of a urologist, a sexologist, or any sex therapist to just get your problem diagnosed, and don't jump onto the conclusion just by looking at the online portals that you might be suffering from this thing, erectile dysfunction or
Right.
premature ejaculation. A number of patients just ask me, what is the required time? What do you think it is
Right.
ejaculating time? I always tell them there is no thumb rule as such for the ejaculation time. It depends upon how and when you and your partner both are satisfied.
Right.
It differs from person to person. A person would be able to continue a sexual activity for half an hour,
Right.
not satisfied. There may be a person who is just satisfied within 2-3 minutes.
Absolutely.
So that is not the question whether a particular timing should be achieved. That cannot be done. It differs from person to person.
Absolutely. Right.
Pranoy, I
Yes,
just
sir.
want to add one more thing.
Sure,
Okay.
sir.
So this is a very powerful sentence, okay? And you can, like you can use the sentence in so many different ways and still make sense. Okay, very simple but very powerful sentence. Thoughts are not facts. Okay?
Absolutely.
If you observe this sentence for a second and think about it, okay, we think about something and we continue to think about it, and we somehow at some stage start believing that it's a fact. Okay,
Right.
so clients and patients, they come, they think whatever they've been thinking as a fact. So as a sex therapist, when you take history and when you go through the due process, what you're trying to do is you're going to challenge that. Okay,
Absolutely.
and
Right.
this can be applied to so many different scenarios, and which we see as clinicians. Okay, so which is, I think it's a
Right.
very and that's why I volunteered, and I appreciate efforts like Pratishanti is doing. This is very good for the audience.
Right. All right. Thank you, sir. Much appreciated. My next question will be to Dr. Lee. We often hear that women should go through regular examinations or pap smears for that matter. What is the actual male equivalent to a pap smear or through this quote unquote examination? And what are the regular steps that men should ensure to get like a good sexual health? And if they're supposed to visit a clinic like women do, how often, and what's like the steps that they're supposed to follow right there?
Yeah, so I just want to say, I want to be clear. I'm not actually a
Right.
medical doctor, even though I have a doctor in front of my name.
All right.
I have a doctorate in human sexuality, so I'm more of a
Right.
sex counselor. And
Right.
so anyway, just to answer this question in general, I think anybody who is sexually active, they may be at risk of catching sexually transmitted infections.
Right.
And so pap smear is just to check for what is already there. So when it comes to people with penises, I believe people who are sexually active, they should go for regular SCI tests.
Right.
And in some jobs, they are required to do this at least once a year. And
Right.
there are places that will have free HIV tests. So in terms of sexual health, like health, I even just a regular body check is fine. There are some insurance, they will pay for it. So a regular body check is fine. But if somebody
Right.
suspects that there's any effects to their health, for instance, like they suspect that they have low testosterone, that is actually a more specific test that they may require. So this is
Right.
when they can requires their GP to make recommendations, for instance, to a urologist. I think that um, all the tips to health are all good
Right.
for general health, whether it's meditation, movement, yoga, whether it's taking herbs, whether it's mindfulness, make sure you get enough exercise and sleep and diet and all these things. I feel that these
Right.
are all the preventive ways of ensuring that you be as healthy for as long as you can.
Right. Absolutely, ma'am. I'll just come back with you with another question that
Sure.
really intrigues me as well because it's on chat. The fact that is there any role of so is this the case that a virgin has a higher sex drive or craving for sex, or is
Okay,
that not the case?
so this is what I think. So let's just use this analogy. I have clients who come to me who cannot have sex. Women who have
Right.
vaginismus, women who have phobia about penetration. And so they may say something along the lines of, I don't understand what's this fascination about sex. I don't understand what's the big deal about sex. We get along fine, we are married, we have the best of times. Why do we need sex in our marriage? So
Right.
I then suggest this to the person who has vaginismus, who has never had penetrative sex, who has fear of sex. I would say something along the lines of, if you have never had sex, how will you know what is good or bad? how will you know if you like something if you haven't done it? So a person who is a virgin, they can still have some idea of what sex is like by themselves, and they can have ideas of what sex can be like with interaction with their partner, and the whole feeling of penetration feels very different, because it's a different form of sexual expression. So if someone who's a virgin has penetrative sex and they like it, naturally they will want more. So I don't think it's true that a virgin will crave more sex or a virgin will crave less sex. I think the craving comes from liking something and wanting to do more and having fun. But if somebody has fear and bad experiences, that is very, very much linked to them not wanting sex and having a low sex drive. So sex is more than just physical, it's mental, it's emotional, it's psychological. However, when it comes to not just thinking positive about sex, it's how can I think positive about sex? Is all I have had is negative experiences. So this is where sex therapy, sex counseling, and having a partner who can support them in their sexual journey or even support them in their sexual trauma or sexual healing is very, very important. So I would say focus less on whether a virgin will have high or low sex drive. Depending on person, they may have low sex drive because the sex they had was bad. Depending on the person, they may have a high sex drive because the sex that they had was great.
Was good, right? Absolutely. Dr. Ramanathan, just building on what she said, right? The fact that some people just do not want to have sex because they've had traumatic experiences with sex in the past, right? How does a person actually, come out of an experience so traumatic that, they're not able to have sex anymore, right? So how do you kind of guide them step by step towards, maybe getting back on the bandwagon again?
Well, I think it's a very long process. It's a very complex process because the trauma is not just the act of sex, the traumatic experience, the overall experience, which impacts on how well the person can trust anyone for that matter. And so the nature of trauma, and sometimes if the person who did it is a known person, then it's a very different story as opposed to strangers. And I had clients where in a young age, under the disguise of religion and how they sort of played with, and still this person, even after married and, having gone through session, it's not easy to let go, because it's sitting right in the center of their brain. So it's a very complex process. But the good news is with correct therapy, with a whole support network, it is possible to overcome, but it really depends on the nature of trauma and how much damage has already happened.
Right, absolutely.
But definitely I would say, this is what I say to men and boys as well. Safe sex is a common term that's used, but safe sex is not just, safe. When you say safe sex, you somehow make you feel whether you are having a lot of bugs or the person whom you're having sex is having a lot of bugs. Safety is not just the only dimension here. So I tend to use the term responsible sex.
Right.
So responsible sex involves safe sex, but it's also treating the sex partner with respect and treating them as equal and being responsible. So that way the chances of any of these traumatic experiences can be minimized. Because the last thing you want is having sex, have fun, and then ending up in unwanted pregnancy or having a bug. It sort of makes you feel very different.
Right, absolutely. Right. Aman, coming back to you, in a student's life, people who are young adults, right? Society isn't very open to us talking about the fact that we have sex, and the fact that there is a possibility that you engage in sexual intercourse with your partner or anybody else for that matter, and you get something, an STD like genital herpes, or for HIV for that matter, right? And you pass it on knowingly or unknowingly. What do you think goes on in the head of a student, and what are the inhibitions that they would face in some instance, and if you could, kind of offer them some words of advice to overcome it.
Right. So a lot of this happens because there's a sheer lack of awareness amongst all of us from the very root level.
Right.
As we've been talking about how many STDs and STIs, like Dr. Lee just mentioned that men should go for regular STDs and STI screenings, just like women go for pap smears. The point is, a lot of us don't realize that the symptoms for many of them can be very dormant and they need not be entirely severe,
Right.
that an STI screening is required. So, and at the end of the day, because these are not detected, people tend to not realize they have some in the beginning. And it is not necessary that penetrative sexual intercourse is the only way, medium of transmission of STDs. There are many other ways through which STDs and STIs can be transferred. So again, there's a lack of awareness in that way. But most people tend to shy away from conversations about these because we have a large taboo that revolves around conversations about sex itself. And when we involve STDs and STIs, it becomes a very no-no topic for most people, regardless of
Right.
the age groups. So it is never talked about within the family, within friend circles, and eventually it goes on and on as a very hush topic. And
Right.
people eventually go on transmitting these STDs and STIs in a very inadequate manner.
Right.
So a very huge piece of advice would be the sheer amount of communication that is required amongst all of us, because unless and until someone is ready to talk about something and talk about what they are going through or what's even going through their head while they're realizing something like this, it's a very important part of all of this, and someone might be able to guide them much better.
Right.
So maybe they just need some sort of emotional and moral support through what they're going through. Maybe they need actual medical advice, but none of that is possible unless that communication is there amongst
Absolutely.
that person. And
Absolutely.
other than that, we definitely need much more awareness than there is currently present. Because I was just going through the class 10th NCRT booklet that there is, which is the one that provides most information about STDs
Right.
to children in our country. Now, all of the science books that we have in our school curriculums, they tend to show for every other disease. They will show that if you have a lack of vitamin A, it will lead to night blindness, and the symptoms of the same are as follows. Vitamin B will have this cause, and it will be the symptoms for this. The reproduction chapter that we have in class 10th, it only ever mentions the name of these STDs
Right.
and how they can be prevented through the use of contraceptives, and that is literally the
Absolutely.
end of the story. So we definitely need to shine more light upon these topics and how they can be transmitted through other mediums as well. So
Absolutely.
that definitely needs to be there.
Right. Absolutely. Very well put, Aman. Um, Dr. Ramanathan, on the topic of contraceptives, my next question is directed towards you. The fact
Hmm.
that a lot of experience of people that has been shared with me and what I've read online also kind of shows how men have trouble maintaining erections, when they use condoms. And there are actually, like, as far as my limited knowledge goes, there are only two methods for male contraceptives. One is, using condoms, and the second is a vasectomy, right? So are there any other methods of contraception? Might not be surgical, but I've genuinely seen people face problems with condoms and maintaining erections in condoms.
Hmm. Hmm. See, it's a very interesting question. So, but I just want to address what Aman said.
Right.
Reflect on that. Countries like India, we are trying to adapt so many things so quickly from Western cultures. Okay, but it's not across all sectors of the society. Okay, the fun bit, the nightclub, the pop culture, the chemsex,
Right.
all that's happening. But when it comes to access to healthcare, especially sexual healthcare, which is one of the 10 sexual rights, we are lagging. When it comes to sexuality education, we are lagging. Okay, and that's why mediums like pornography and internet takes the upper hand. When there is no formal sex education, people rely on pornography, and somehow they think whatever they hear from their friend has to always be correct. I don't know why. Okay,
Right.
even though where the friend got that original information, that's questionable. But when they hear from a friend, they somehow think that's correct. So there are definitely, as Aman said, there are a lot of issues in terms of education and awareness. So that's a long way. Now, coming back to your question about condoms. Now, using a condom or surgery, well, there are other ways of negotiating. As I said before, it's about responsible sex.
Right.
People do, not ejaculate inside, but ejaculation in, either inside the vagina or anus. I'm not being very heteronormative here, whether it is male, or male, female. So definitely condom is the best protection for many, many STIs. But negotiating condom is a very important one. If you're going to use it at the heat of the moment, or if you're going to remove the condom at the heat of the moment, it's going to cause trouble.
Right.
Now, why wearing a condom makes it less pleasurable? It stems from the thought that condom somehow it forms a barrier. Okay, it's like having, there are common misconceptions that sex with condom is like wearing a plastic bag. It's somehow processed in the mind that condom makes sex less pleasurable.
Right.
Yes, there is an element of truth in that. Yes, it might be less pleasurable, but it is more responsible. Okay,
Right.
You want to have sex without condom and enjoy that 5 minutes, or do you want to enjoy and take a risk of having an STI and regret about it and undergo medication, treatment, contact tracing, and creating a rift in the relationship? Which
Right.
one is responsible? So pleasure versus responsibility, they have to make that call. And this is where drugs and alcohol come into play. It makes that big imbalance in making the
Right.
decision. Okay,
Absolutely.
so it's about building the schema of introducing condom and make it pleasurable and responsible.
Right.
Okay,
Absolutely.
but saying that, nowadays, at least in Australia and other Western countries, they are taking medications to minimize the risk of HIV transmission.
Right.
It's called pre-exposure prophylaxis. It's called
Absolutely.
PrEP. Okay,
Right.
so when a guy is having PrEP, then, and if they're not using condom, we cannot say that that's unsafe sex anymore, because they are
Right.
taking some medication to prevent HIV transmission. So we have to say it's a condom-less sex.
Right.
Okay, so the lingo is changing rapidly, but I
Absolutely.
still think condom is the best way to minimize a lot of risk, including
Absolutely.
unwanted pregnancy.
Absolutely.
And definitely there are different varieties, thin condoms, there are, you can make it pleasurable and
Right,
also
right.
remain responsible.
Right. Thank you, Dr. Vijay.
I'd like to add one thing. Your initial
Absolutely, sir.
question was, while just putting on the condom, some patients lose erection.
Right.
That's
Well, putting on the condom, losing erection, the size of the condom, we need to trial it, okay? Because if the penis size and the condom size are not matching, then it becomes an issue, okay? And also,
Dr. Vijay, even if the patient is suffering from ED, that is venous leakage, in that case also, the patient loses his erection while putting on the
that's right.
condom. And one more, even psychological effect is there if he got any kind of stress on his mind. So when he just goes to just put on the condom, his mind changes, thinks about something else, and he loses.
True. Remember, Pranay, I told you before, it's one leg on the accelerator, one leg on the brake. Okay, so putting a condom is applied more on the brake. Okay, so that will automatically reduces the speed. Okay, but
absolutely,
if a person is anxious about putting a condom, if he doesn't know which side to pull it, then your distraction. It's called cognitive distraction. If you want a technical term. So the person focused from that urge is now putting a condom. So that's why putting it beforehand or having the partner to help put the condom, that in itself can be made it a bit erotic.
Right.
Okay? So when we look into assessing a case formulation, we need to look why this person is having a problem, why this person is having a problem now.
Right.
Okay. So whether condom could be just a precipitating factor, but as Dr. Bolo said, the person could be having problems even before that.
Absolutely.
And condom is only accelerating the problem.
Right. Dr. Lee, I believe you had something to contribute to this question.
Sorry, excuse me. Okay, so a lot of people who masturbate, they don't masturbate with condom. So then when they have sex with someone and they want to put on a condom, they're not used to it. So when they're not used to it, they're not used to the sensation. They may fumble, they may lose their erection. So if someone has negative experiences with the erection around wearing a condom, they may say things like, condom doesn't work for me. I can't have an erection if I'm putting on a condom. But in reality, have they tried to masturbate with condom?
Right.
Because most people masturbate without condom, and even the idea of masturbating with condom doesn't occur to most people. So I know condom can stretch, but the size of the condom and the size of the penis can also coincide. So you can actually measure the penis. You can find a brand and a feel and a material that feels more comfortable to you, and then you're practicing masturbating with condom. So then you're not second guessing yourself, you're not fumbling, you're less uncomfortable about using condom when you're by yourself. Then you're more likely to be able to use condom when you're with a partner. So these are just some of the tips that I teach my clients. But it is true that sometimes the difficulty to sustain an erection has to do with a physical cause. For instance, the nerve. There's also the option of female condom. So female condom is very uncommon in Asia, but the female condom is when it's put inside the person with the vagina,
Right.
and so the person with the penis doesn't have to worry about whether he's erect or not, and then it's just about pushing the penis in, even if the penis is
Right.
soft. Because it is possible to have soft penis penetration. It's just that I think it does come across as not sexy, so most people don't think
Right.
about it. So when it comes to contraception, just now was asked, besides bisectomy and condom, male condom, what can be used? So there's the withdrawal method. So that's withdrawing before you ejaculate. But people with premature ejaculation may have accidents. So there's also the rhythm method, where you keep track of the person with the vagina, her ovulation cycle, and then you have sex only during those periods that are considered safe. So the rhythm method comes from the Catholic Church, but this is actually a technique that people can find online. You can read about it. You don't need to spend money to actually follow the instructions
Right.
of the method.
Right. Absolutely. That I honestly did not know whether there's a female condom or not. Yes, Dr. Ramanathan.
Oh yeah, there is female condoms are there, but
Right.
it sort of, it looks very different, and it can throw up few men and women looking at it.
Right.
See, the other thing is, in terms of some men, when they, especially couples that I see in the fertility setting, they started having sex and they plan not to have a child in the early days of their marriage. So they start using condoms. And then the day comes where they think, okay, it's time to have a child, and
Right.
they wanting to do sex without a condom, they face problems with erectile dysfunction.
Oh, right.
Okay? Because you need to understand that there's an element of neuroplasticity when they start programming in a particular way, and then if they want to do it the other way, it will be challenging and difficult. But the good news is you can reprogram it.
Right.
Yeah.
I would like to add one thing. It's in fact, it's not the change of the condom at that time. It's the pressure built on their mind by their families to go for on a family way. So when they think that now we have to produce a child, they have got some load over their mind. So that is creating the problem. That is leading to, because that leads to so many pressures and stress on the man's body and mind, that he's not able to even sustain the elections, just because of the pressure of starting a family. So that is more important for the person. Whenever a couple comes to me to now we have started on a family way, but all of a sudden we have seen there is no erection.
Right.
Or erection comes, it's suddenly just fades away. So
Right.
that is, in fact, I tell them, don't plan. You are not God.
Right.
I simply tell them, just keep on loving each other.
Yeah.
The way you were loving earlier. And let that be the fruit of God as a fruit of your love.
Right.
So,
But I think a lot of it comes from
would
the
be
time
much more important.
Right. I like what Dr. Lee has said, that the fact that difficulties with erections during making babies makes the desire of like pleasure actually into a job, which might affect how you perform during the same.
That becomes more of a task to them.
Exactly.
Becomes more of the task to them, and they just, instead of feeling about the pleasure about their activity, they just think about the completing the task.
Right.
True. And what happens, Pranay, men are reduced to a level of sperm donors. That's it.
Right.
Okay. They're there to give sperm. And a lot of gynecologists dictate a timed intercourse. And to be very honest, can it be stressful? It is extremely stressful. Okay. There's a lot of studies looking at the fertility aspects on men's sexual functioning, because what used to be a private encounter, now the gynecologist is actually checking whether the couple had sex or not.
Right.
Okay, when there's a pressure to give semen sample, it all creates that level of anxiety and stress. Okay,
Absolutely.
but there are delayed ejaculation is a major problem in that setting, because if they're having and they're not able to ejaculate, then premature ejaculation is not so much of a problem when it comes to fertility, but delayed ejaculation is a very difficult problem.
Yeah.
Absolutely.
Very well said, Dr. Vijay.
Thank you, Doctor.
Great. So my next question being to Dr. Lee, Dr. Lee, the fact that there are, and this is something I received in chat as well, the fact that there are often concerns about excessive masturbation and being addicted to pornography. So is there a thumb rule as to what is the healthy frequency for watching pornography, and should an excess be should that worry an individual to certain health concerns?
Yeah, okay. So a lot of people are very, very concerned about addiction, and we throw the word addiction around. There is a sex addiction, there is masturbation addiction, there is porn addiction. So what does addiction, the word, really mean? When people throw around the word addiction, I don't think they even know what it really means, because there is a fine line between what is so-called common. Most people are doing it. Most people with penises, most people who have penises tend to be more visual. They tend to think it is common because they hear everyone doing it. So most people with penises that come to me, they do masturbate to porn. So then when they start to masturbate to porn, they start to worry that they are doing too much of it. And it's almost as if there's this fear of eating too much of something we like, eating too much chocolate, eating too much food. And I think, let's say, for instance, we eat too much food. We can tell when we eat too much food that the food doesn't taste good. We are not hungry, but we're still forcing ourselves to eat. And then that the other effect of eating too much food, we gain weight. So what happens with people who masturbate to porn every single time and start to worry that they are addicted to porn or dependent to porn is that most of the times they are dependent on it because they don't know what else to do. Nobody actually shared what else to do to masturbation other than watch porn. So most people are not taught how to masturbate in creative ways. For instance, like masturbating with fantasy, masturbating by playing with breath, sound, movement, touch, intention, pelvic floor squeezes, and being very mindful of the sexual energy that is generating in your body, and maybe even channeling it to your intentions, just like how we channel our intentions when we pray. So because we are not taught how to masturbate in creative and different ways, and then we throw around the word porn addiction, masturbation addiction, we actually create a lot of anxiety and fear, because then they do it and then they feel that they must be addicted. And addiction, I have to recommend that we start to think about as an addiction is called an addiction because we cannot control ourselves. But most people who masturbate, they are masturbating from choice, and they can control themselves. But the reason why they haven't changed what they do is not because they can't control, it's because they don't know what else.
Right.
So I think we are being very, very unfair to men by saying that, oh, now with the internet era, everyone is a porn addict. I think it's very scary because then everyone is scared of sex and everyone is scared of porn. So in our culture, it's true, we don't get much information about sex and we don't get much modeling when it comes to sex. And a lot of people don't know how to have sex. So actually, porn is a form of sex education, and porn is probably the first form and the earliest form of sex education for a lot of people. However, if they are feeling that the porn images are whatever you want to call it, dirty, disgusting, sleazy, doesn't make them feel good, makes them feel that they are objectifying women, then
Right.
by all means, try and explore other forms of porn, because there are porn made by women for women. And
Right.
so those kind of
Absolutely.
porn tend to be more sensuous. Those kind of porn have a plot. And then there's also this term called ethical porn. So ethical porn happens where everybody who is in the program agrees to every single sexual act. And everybody who is acting in that show is paid
Right.
fair wages. So there are people who watch porn who don't even want to think about such things as ethical, that people are consenting to being filmed and like what they are doing. And so we get a lot of modeling of rough sex, of abusive behavior,
Right.
and then we cannot help but start to think, is this what women like? Is this what I need to be a good lover? And so I think all these things that doesn't serve us, we can ask ourselves more deeply, what kind of a person do I want to be? What kind of a man do I want to be? What kind of a lover do I want to be?
Right.
What kind of sex life would I like to have with my partner? I think we have a lot of modeling from our parents of
Right.
like respect your elders. We have a lot of modeling from like don't question your husband, and maybe the things that we have witnessed from our parents and people around us is not what we want in our own lives. So rather
Right.
than caught up with doing things unconsciously, I would suggest that we ask ourselves deeper, who am I? What do I want? What kind of man do I want to be? How can I explore myself so that the way I express my
Right.
sexuality is more authentic?
Right. Absolutely.
Yeah. So I would say don't be afraid of porn, don't be afraid of sex, don't be afraid of addiction. Most people are not addicts. Addicts are called addicts for a reason. They will have addictive tendencies to everything. So
Right.
let's say, for instance, a smoker cannot stop smoking. A person who drinks cannot stop drinking. A person who is into recreational drugs cannot stop. So
Right.
they cannot stop. They go really, really deep into it.
Absolutely.
They really tend to have compulsive behaviors. And so this is actually the true definition of addicts. So they can even skip
Absolutely.
work, they can even not shower, they think of gaming addicts. So they can actually stop living functional lives, maybe not study, not go for exams, not even do anything responsible like shower or
Right.
brush their teeth. So when someone is to that form, then we can call them addicts. But other
Absolutely.
than that, please don't throw this term around, because I think maybe about a small percentage, let's say 10%
Absolutely.
of the population are really what I would define as addicts. So I just want to reassure people, please don't be so scared of your sexuality. We are scared because we don't know. We don't know because we didn't get sex education. But
Right.
now that we're adults, we can go and get the sex information for ourselves and realize that sex is actually really wonderful, it's amazing, it's fun, it's empowering, and it's actually meant to be something that we feel good about.
Right. Absolutely. Thank you, Dr. Lee. Very extensive. Brilliant.
So
So,
I
absolutely, yes,
was
sir.
getting late. Actually, I was told 1.5 hour
Not an issue,
of
sir.
the
Not
conversation.
enough. Not an issue.
So I just thank all my co-panelists and speakers and you people for inviting me. I take your leave.
Thank you so much,
Thank you
Dr. Lee.
very
Thank you
much.
for
Thank
being
Thank
here.
you.
Thank
Thank
you.
you.
Thank you, Dr. Vijay.
Thank
Bye-bye.
you. Thank
Thank
you.
Thank you,
you.
Aman. Dr. Lee. Okay,
Thank
Pranay.
you. Nice to
Thank
meet
you.
you.
Thank you.
Thank you.
So Pranay, I just want to add on with Dr. Lee said, porn has
Absolutely.
been there. Porn has been there for many, many, many years. Okay.
Right.
So there are 3 A's that made pornography very interesting. And one is, it's anonymous. You can watch porn without putting any of your details on it.
Right.
Second A is you can access it anywhere. Okay, while in the classroom, you can still access porn.
Right.
Okay, so so it's the access and the anonymity it has made pornography widely used. But this is it. We cannot blame paddy, rice, for the increasing number of diabetes. Okay, it's
Absolutely.
responsible use of rice. The same
Right.
way food is there for a reason, and it's there. But in a clinical situation, when men come, they want to act out what they see in pornography. That's
Right.
where it becomes a problem. Whether it is
Absolutely.
addiction, whether it's a dependency, compulsory, that's not a big issue. But when they want to take norm from the pornography and they want to act on pornography, that's when it becomes a problem, because they see, oh, I saw, in the movie that girl, did this something, so I can also go try it with the girl in the street. That is not
Right.
true. And I tell my clients, okay, can you fight like what Shah
Right.
Rukh Khan or Rajinikanth does? No, sir, that's a movie. The same principle applies here. If they can have the literacy level to understand this is just a movie,
Absolutely.
and watch it, then it's fine. But when it starts creeping into their life, that's when it becomes a problem.
Absolutely. Thank you, Dr. Ramanathan. All
Thank
right, I
you.
have one last question for Aman, after which we'll move on to Q&A with the audience. Aman, very often, right, we have sexual desires or we have sexual fantasies that people are very, awkward or embarrassed to share. That might be an Oedipus complex, that might be an Electrus complex, right? So what do our fantasy, is there something that do you believe that our fantasies speak about our personalities? And should we actually be concerned if they're out of norm? And how should, a person communicate if or embrace them?
Okay. So I don't believe that our fantasies tend to rely on what our personality type is. I've seen people with fantasies that are directly opposing to what their personality types is. It's
Right.
more about what we're kind of subjected to, the kind of environment we're around, the kind of as Dr. Ramanathan just mentioned, that people tend to be exposed to a lot of movies and TV shows, and they tend to see that this is the sort of thing that's already out there. And so, subject to all of these kind of things, we form our own fantasies on the basis of that. So, I don't think anyone should ever feel afraid or awkward or embarrassed to speak out about their fantasies in the fear that it will speak volumes about their personality. It's just something that we kind of fantasize about based on what we're subjected to, the kind of environment that we are in. And again, as for how to better talk about these things and not have that fear or insecurity in our minds, I think open communication between a person and their partner is very important. And a thing that they must realize is that that fantasy can't exactly come through, or they can't exactly experience it if they don't have open communication about it. And again, they need to realize that that open communication between partners is extremely important. So of course, that bridging of a gap is something that people need to do in a relationship or in their physical relationship. So right, and of course, never to think that it speaks volumes about their personality, because at the end of the day, people might have very opposing personalities as compared to their fantasies. They might be directly in line with their personalities at times as well. So it's a matter of what we're subjected to and what goes on inside our mind.
Right. Dr. Martha, Dr. Vijay, do you agree?
Totally agree, but I just want to add an element to it.
Right.
As I'm living as a migrant in Australia, what is fantasy in one culture is a reality in another culture. Okay, because it's not more of a culture, more of a society thing. Okay,
Right.
so so social nudity is a sort of a fantasy, but in countries like Australia, that's a different story. You have legal nude beaches where you can go, so it's sort of social differences are there. But fantasies, it's a very interesting concept in itself. We can have a whole session on that. But yeah, I totally agree with Aman. So whatever he said.
Absolutely.
The problem is when you act out on one fantasy, your mind doesn't stop there. You want to go one step further and one step further. So where do we draw a line? Okay.
Right. Absolutely.
So, and the analogy I use is fantasy is like spice in your curry. Okay. If you had a little bit of spice, then the curry tastes nice. But if you can't make a whole curry out of just spices,
Right.
okay, it's not palatable.
Makes sense. Right. Dr. Lee, do you agree as well?
Yes, I agree.
Brilliant. Right. All right. Thank you so much. That was all the questions I had from my side. We'll now open it up to questions from our audience. Right.
Yeah.
So, attendees, you have this questions option here. Please feel free to drop them here. Until then, I'll, talk, just ask them the questions that are here till now. Please drop in your questions. Thank you. Right. All right, panelists. The first question is that how do you, and any one of you can take this, right? How do you suggest teaching a young boy about sexual health when there is no sex education in school?
Okay. Can I go first, Dr. Lee?
Yeah, of course, of course.
Yeah, I think the parents need to be taught first. The parents need to be well equipped to give age appropriate education. Okay. One common myth is, oh, if I talk about sex, they're going to become very sexually active, which is just a myth. Okay. So age appropriate information need to be given. And there are resources, and especially in countries like Australia, I'm sure in Singapore they'll have some form of education. But India, I'm not too sure. But there are recommended age-specific topics that we can talk. But the most important thing is making kids assured that it's okay to ask questions about that, rather punishing them or turning away from those questions. I think that is one big step to start with.
You're mute.
Mm-hmm.
You're mute. Our host is mute.
Really sorry. Really, I did not realize that. All right. So thank you, Dr. Ramanathan, for that answer. Dr. Lee and Aman, you can answer this as well if you want.
Yeah. So what is the question?
Ma'am,
The
how do you suggest teaching a young boy about sexual health when there is no sex education in school?
Yes, good question. Okay, Aman can answer first.
Right. Thank you so much, Dr. Lee. Just like Dr. Ramanathan said, that in Western cultures, there are a number of resources that might not directly be available in a country like India. I think exactly what he said, that age-appropriate information needs to be propagated to children. For example, someone who is in elementary or middle school, they can't directly be taught about contraceptives and STDs and STIs when they don't even know the general basics. So safe touch and boundaries and the kind of things that a child might like and they will go through once they hit puberty, that is definitely something that we need to talk about at early stages. And then we, of course, in the adolescent stage of a child, we need to talk about the different bodily changes that they're going through, the different urges that they will have. So of course, age appropriate information is definitely there. And adding on to what Dr. Ramanathan said, that a lot of opposition in countries that is faced to sex education is that talking about it is going to kind of promote that kind of culture, and it will lead to more sex. At the end of the day, even if it does, the point is that it will lead to more responsible sex, just the way that Dr. Ramanathan proposed it. When we use contraceptives, we're not just having safe sex, that is a part of it, yes, but we're having responsible sex. When STDs and STIs are not being transmitted, there aren't any unplanned pregnancies, so that is a big part of it. So tomorrow, it's not if that we don't talk about sex that it's going to it's going to be stopped anytime soon. It's still going to be there. But giving sex education to children, it's going to prevent abusive relationships, it's going to prevent sexual violence, it's going to prevent all of these things that we don't want. So definitely that needs to be there, and it needs to be there right from a young age, so that we never feel there is a hindrance to talk about it, or there is a right age to talk about it. That say, if my younger brother comes up to me and asks me a question, I have to say that this is something that I can't answer to him, and I'll answer it to him only when he hits the age of 18, or only when he hits a certain age. So that age appropriate information is also important, so that we never feel there's an age barrier to knowing all of this.
Right, absolutely. Dr. Lee?
Yeah, let me look at the question again. Okay, so I feel that it takes a village to raise a child, and in the ideal world, the parents, the neighbors, the relatives, the school, the society, the government all plays a part. But what I am seeing is adults coming to me and wishing they had sex education. So I don't want to criticize our government, religion, culture, society. I just want to focus on what we can do to make a difference. So this is where such forums with young people coming is very useful, because the young people want to hear, but where do they hear it from?
Right.
So when we take self-ownership and we start to move away from being a child into being an adult, you realize the way adults think is, let's not try to criticize or condemn. Let's just focus on what I can do, what I need to learn, what I can be okay, so that I then can go out there and help other people. So this is exactly
Absolutely.
what this organization is doing by creating such forums.
Right.
So for the audience here, I rather focus on what you feel you need to increase your sex education. So one of the easiest ways that was not available when I was growing up because there was no internet is YouTube. So there are some very good YouTube channels that are made by people who are highly educated. There are people
Right.
who are also don't know what they're talking about and they are just charismatic or interesting or pretty. So look into the credentials of the people that you are searching for such answers on YouTube and look at their credentials. And you will find that actually there's a lot of information that's out there. It is just that in all that noise, who do you listen to? And I think a lot of people just give a lot of attention to the next bright shiny object. For
Right.
instance, Anthony Robbins or whatever. They may be look good. They may be very charismatic. They may talk some sense. But when it comes to sexual health, say for instance the bright shiny coach, they may not have all the information. So stop giving away your power and take back your power, your self responsibility, and go and seek out the information to whatever you need. And of course, there's the case of I don't know what I don't know.
Right.
So start from somewhere. So a very good website that I like is Scarlet Teen. And in fact, I spoke to the founder of Scarlet Teen several years ago because I'm in Asia, and they said that actually a lot of their support comes from South Asia because they don't know where to go for sex education. And Scarlet Teen is a very good website that has very comprehensive answers to almost every sex question that a young person may have. So it's basically highlighting and celebrating good resources that are already out there because there's no need to keep reinventing the wheel.
Absolutely. Thank you, Dr. Lee. I think we have two or three more questions. The first question being that in case something that Dr. Lee's already answered, I'd like to take Dr. Ramanathan's take on this. In case someone has had a traumatic or disturbing experience which might make one nervous or cautious, what should a partner do to make the other feel comfortable?
Well, I think, as Ahmad said, communication, talking about it in a non-threatening and welcoming way, that it's okay to talk about it.
Right.
And depending on the nature of that experience and what it has done to that person's life, then taking appropriate care, whether from a psychologist or depending on there are, because trauma is once again a very broad term, Pranay. Okay,
Right.
we don't know what
Absolutely.
trauma we are talking about. So talking about it, acknowledging that it's a problem, because if you don't have insight, you can't change anything. You need to have that insight that it is a problem and it's okay to talk about it in a safe and non-judgmental way to your partner, and then seeking help together is a very responsible way to do that.
Absolutely. Aman, would you like to contribute something to that as well?
Right, just what Dr. Ramanathan said, that acknowledging it is a big part of it, because at the end of the day, not talking about it kind of leads to that thing remaining within the other person's head, and they automatically feel unsafe in different situations. They feel uncomfortable because not acknowledging it just leads to that uncomfortable feeling. So talking about it is a big way to deal with it together in a relationship, and being comfortable with your partner, being able to acknowledge it with them, and being able to be vulnerable with them. That's the entire point that was also raised by Dr. Lee before, that for a lot of people, sexual health is not just about the physical intimacy itself, it's also about the emotional intimacy. So that also comes along with being vulnerable to your partner, being able to tell them different things, being able to talk about all of this. So definitely acknowledging it, talking about it, being comfortable enough with your partner.
That's right, Pranay. If you look at the word sexual health, if you swap the words around, it becomes healthy sex. Okay, it becomes much broader. Okay, if you say mental health, healthy mind, it gives a positive spin to it, and that's what I encourage with my clients as well. Avoidance is a great remedy for temporary relief, but it doesn't fix anything.
Right.
So rather avoiding it, take one baby step. Okay, make small changes, and then it will build on from there.
Absolutely. Thank you, Dr. Ramanathan. All right. So, can any of you shed some more light on hypersexuality as a mode to deal with stressors in life? And is it something, men turn to more than women? Any one of you?
Okay. Hypersexuality, first we need to understand what is the baseline we are using to call something as hypersexuality. I think we shouldn't get too much in the saga of the words here and rather look at the issue in front of us. Okay, what is the problem? A lot of clients come thinking they have a problem and they think they have something abnormal. That's not because they have a problem, they don't know what is normal. Okay, and normal in sexuality is a very contentious issue. What is normal? Okay,
Right.
so it varies from person to person, it varies within the person, it varies from culture to culture. Okay, so rather getting into this argument of hypersexuality, I would say rather giving a label which makes it very hard to discuss and communicate, I would rather take what is the issue in front of us and deal with it.
Right. Brilliant. Right. All right. Any other one? Any one of our other two panelists wants to answer that as well?
Yeah, I already answered the whole spiel about sex addiction. So
Right.
hypersexuality, essentially the word just means too much. So again, it's very much linked to what I answered about sex addiction.
Right.
People think it's sex addiction, or people think people masturbate to release stress,
Right.
because actually there are many ways we can release stress. So I would suggest exploring different ways we can release stress, because what works for a time it's what works for that time. So what if we explore different ways to deal with our stresses in life, and then we find that we have a whole arsenal, a bag of tools that we can use to let go of stress, rather than blame sex, because sex is the way you release stress.
Right.
Sex doesn't have to be the way, and sex doesn't have to be the only way. I'm not saying sex cannot be the way, but it doesn't have to be the only way.
Absolutely.
Sure. And what Dr. Lee says, Pranay, it's sometimes you call it sex education. The title itself is very problematic. Okay,
Absolutely.
but you can call it life education. Nobody counters you. Nobody challenges you. You call it life education, and then you talk about sex. It's not a problem. But when you say sex education, oh my God, sex, bad word. Okay, and I totally agree with Dr. Lee. A lot of these clients, they don't have life skills.
Absolutely.
Okay, it's not that they have a problem or they have some bad genes or anything. They just don't know how to deal with their life.
Right.
Okay, and it's like expecting somebody to learn how to save money when they turn 18. It's
Right.
not easy. And so does driving. You cannot just expect somebody to learn driving all of a sudden. Yeah, so it's a life skill. So
Absolutely.
totally on par with Dr. Lee.
I agree. Right. So the last question that we have is directed towards Dr. Vijay. Can you tell us more about penis foreskin and what is normal for a healthy penis? And if I think I have a problem regarding that, whom should I consult?
Okay, so foreskin, once again, the circumcision has been heavily promoted for HIV reduction, risk reduction, but foreskin can also be, it can be seen as a part of the sexual repertoire. You can leave it. It's not that you have to do circumcision, right? So you can leave it as long as if you can roll back the foreskin, you're able to keep it clean. And when I say clean, don't put soap, just warm water is more than enough, because men, sometimes they get all worked up, they put shampoo, hair conditioner, everything on it. No need at all, no soap at all. The more soap you use, more chances of fungal infection. Okay, as long as you can roll back the skin nicely, then it's all good. Okay, but in terms of if you can't roll back, or if you have infection there, if you have diabetes, I have seen young men who don't know that they have diabetes, but they present with a condition, and the skin becomes thickened. And when you do a blood test, you get to see they have very high levels of diabetes. Okay, so those conditions, if the foreskin becomes very tight, in a fact that it can't roll back, then you have to do a circumcision, right? So what happens is when they have a very tight foreskin, when they're trying to have penetrative sex, it will push it very hardly, and it creates a hell lot of a pain. And from that point onwards, they start linking intercourse with pain, and they'll have difficulty keeping an erection. Okay, so it's a vicious cycle. So what to do about it? You can talk to your urologist, or you can talk to a general physician, talk about it, let them examine, and then you can take it from there. And if surgery is required, but you will get over it. You can't have any sex in any form for the 2 weeks, but thereafter, you can slowly come back to it.
Right. All right. Looking at the fact that we don't have any other questions, thank you, Dr. Vijay, Dr. Lee, Aman, and Dr. Bhola, who isn't here. Thank you so much for sparing your time for us.
Thank you.
Thank you.
A lot to everyone here at Pratisandhi.
Thank you, everyone, for being here. We love people who come.
Right.
Thank you.
And it means, and it's actually a very good cause that's being promoted here. Sexual health, or life skills for that matter, is something that is very important, and I'm glad to be, associated with an organization who does it. Thank you so much.
Good job.
Thank you. And a lot of men need to be taught about women can
Absolutely.
masturbate, and women can also experience orgasm. So that equality has to be addressed. And thank you for having me, Pranay and Aman.
Thank you so much.
See you,
Before
Dr.
we-
Lee.
Yes, thank you. And nice to
I just have 3 things to tell everyone. Some things like women can also masturbate. Penis land does not matter, and it's okay to talk about sexual health. Beautiful. Very important, right? All right. Thank you so much. Thank you so much, everyone. Thank you for everyone who attended. Thank you so much.
Thank you.
Thank you.
Thank you.
I don't know how to leave.
I think
Exit button.
right here.